Welcome to this first presentation from Health Justice Australia on how to start up a Health Justice Partnership. I'm Tessa Boyd-Cain. I'm the CEO of Health Justice Australia, which is the National Centre for Health Justice Partnerships. With me on this presentation are Katie Ronson from Justice Connect, Faith Hawthorne and Jess Eastwood, who are from Justice Connect and CoHealth respectively, Dr Nicole Woodrow from Royal Women's Hospital, Linda Gyorke from Inner Melbourne Community Legal, and Jess McCartney from Loddon Campaspe Community Legal Centre. Each of our presenters will be sharing with us this afternoon their experience of starting up a Health Justice Partnership and some of the challenges and opportunities that that work brings. Health Justice Partnerships are an expanding way of working that provide access to legal services through health settings. They're a response to evidence that large numbers of people have legal needs for which they will never go and see a lawyer, but which they are likely to talk about in the trusted environment of a health setting. This afternoon, we're going to hear from a range of presenters about what it is that they're doing through Health Justice Partnerships and help you think about whether this is a way of working for your community service. Health Justice Australia, the National Centre for Health Justice Partnership, is providing support to expand Health Justice Partnerships through the development of evaluation and other research, through resources that support partnership, and by connecting the experience we're seeing within Health Justice Partnerships to lasting change through systemic advocacy, policy and program reforms, and other ways of helping ensure that our human services better meet community need. Throughout this presentation, if you've signed in through a Google account, you'll be able to participate in the online chat, and you'll also be able to receive information about the things that we're talking about, including resources that can help you further through that online chat. That concludes the introduction to this presentation, and we'll move now to hear from our presenters. So Jess from Loddon Campaspe Community Legal Centre, working in a Health Justice Partnership with Bendigo Community Health Services. Tell us a bit about how you established the Health Justice Partnership in Bendigo.
So we were generously granted a fellowship from the Clayton Utz Foundation to be able to research medical legal partnerships and the advantages of them. As part of that fellowship, our former executor officer was able to travel to the US to conduct research into them. Out of that, it was seen that there were significant advantages, and it was decided that a pilot would begin in Bendigo. So based on the US, a crucial component of establishing a health justice partnership is building relationships with health service providers in the region and identifying a primary partner and operational model and an area of focus for the project. So in doing that, there were two major stages of that. So the first was scoping. So in order to scope who was the most sufficient partner, we engaged a project development worker in 2013 for 6 weeks. 6 months, my apologies. And she researched many different health organisations. I think there was 4 different organisations, and it was identified that the Bendigo Community Health Centre was the most appropriate one. So we had shared philosophies with the Bendigo Community Health Centre, both focus on disadvantage and poverty of clients. So with that shared philosophy and key champions at Bendigo Community Health Centre, we decided that that was the most appropriate one. So there was quite a bit of research and effort put into identifying who would be the most suitable partner for us.
Thanks, Jess. And have you formalised your partnership in some form of document or other agreement?
Yeah, so we had a 3-year project. So it was funded by the Clayton Utz Foundation. So after the scoping, the second stage of that was actually implementing that. And that was through recruiting a lawyer, and the project was to go for 3 years. So to formalise that, we had a memorandum of understanding, and that's how we formalised the partnership.
Thanks. Does anyone else have anything they want to add about establishing a Health Justice Partnership? And do you have any advice for people about funding and sustainability once you think you've got the makings of a partnership?
Yeah, I think in terms of funding, we actually did evaluation of the project, which was wonderful, because that can show the benefits of the partnership and help in funding applications. So I think getting that evidence to support the benefits of the Health Justice Partnership and what you're doing is important. And also just looking at key players out there who would invest in there and looking for any opportunities. So we were lucky enough to be granted funding from the Clayton Utz Foundation for this project. We have been granted some additional funding, and now that the project is finishing, we're working around how we're going to continue working with that. We may need to limit our service providing there. Yeah.
That was Jess McCartney from Loddon Campaspe Community Legal Centre, working in a health justice partnership with Bendigo Community Health Services. And that concludes this part of the discussion on the establishment phase of a health justice partnership. So, do you want to come forward? Mm-hmm. If you step back, Jess. Thanks. Come forward. In this discussion about establishing a health justice partnership, we're joined by Linda Gyorke from Inner Melbourne Community Legal and Dr. Nicole Woodrow from Royal Women's Hospital. We'd like to hear from you about some of the ethical challenges that you might have experienced in your work in a health justice partnership.
Sure. So most people, when they think about health justice partnerships, they think about collaboration, they think about working together, health professionals and legal professionals working together. But obviously there are some ethical barriers to working collaboratively as a care team, and those are predominantly legal professional privilege and the confidentiality that health professionals have around their clients' medical records as well, and how to overcome those. Another big barrier, especially in developing a health justice partnership with a major metropolitan hospital, is that you can sometimes, especially in the embryonic phases of a project, be forgotten. And so you want to be providing the hospital with case studies and information about the work that you're doing, but obviously you can't provide that feedback to the referring practitioner without the client's consent. So what we have done is we've introduced into our intake sheet for all clients that we see across the 3 hospitals that we partner with, a question where we ask every client whether or not they consent to us informing the referring practitioner whether or not the client attended the appointment and whether or not we could provide assistance to that client. And if we require further collaboration with the referring practitioner, we then ask the client to fill out a full consent form, and we would then, provided it's in the best interest of the client, go back to the practitioner and seek further information in relation to the patient or the client's details. Is there anything you want to add, Nicole?
Absolutely. Hi, Linda. Hi. So I guess the difficulty for healthcare practitioners, and I think this was witnessed in the beginning at Royal Women's, was having to create trust and faith between us, and not just also understanding that the Health Justice Partnership was present and aware. And initially, when doctors and nurses hear about lawyers in a hospital, there's always a fear of medical negligence. And that's something that was very well handled, I believe, at the Royal Women's, where it became very, very clear the importance of social determinants in health had to be discussed openly. And in fact, that is part of the work that isn't done within a health justice partnership. Our social workers at the Royal Women's are respected for their fantastic work as the experts in social determinants of health, and they've been the conduit for healthcare practitioners, for the midwives, nurses, and doctors. And they were initially the referrers when it all started, but now they really act as a conduit when queries come up from the workers in the hospital. And it's very important on the front line to have information about your health justice partnership championed among individuals who really believe in it and agree with it. And I think that's happened well at the Royal Women's with lots of workers.
And I might just add to that we've got a dedicated hospital phone line at our legal service. So we know if that phone is ringing that it's either a patient from one of the hospitals or it's a staff member from one of the hospitals. And often staff members ring asking for what we call secondary consultations. So they've, an example of one of the calls I've received is from a social worker who said, my patient's told me that they're on bail. I'm not really sure what that means. Could you just explain that to me? And it's just a matter of providing some information about the definition of bail, really, so that they can provide that information to their client. But obviously, we need to be very clear that they can't provide legal advice, only legal information. And if we determine that advice is required, then we'll book that client in for an appointment to see us for that further advice. And I might also say that in relation to providing that feedback loop, provided we determine that it's safe for a client to provide their case study, and provided that client obviously consents to providing their case study on a de-identified basis, we often do seek consent from clients once we've closed their files to provide de-identified case studies, so that in the hospital-wide newsletter or when we're talking to practitioners, we can say, look, I can't talk to you about this specific client you've referred. However, here's an example of a client that we've been able to assist who's been in a similar scenario, provided that client's consented.
Thank you.